I've been working in mental health for over a decade in a myriad of different programs, and AIM's mission resonates so deeply with me because of the emphasis on research and the creation of programs informed directly from that research.
What AIM does is multifaceted. I think one of the most important things they do is building a network of support for young people who are beginning research careers. You give people a start, and then there's a lifetime of great work that has potential to help many, many young people.
AIM is really stepping in by funding early career scientists who we need to grow more of to be able to do this work, to understand what is causing youth mental health problems, how do we better treat youth mental health problems, but also not only funding those young investigators, but funding research that puts clinicians, patients, and researchers together in the same room.
With the AIM Ideas Lab, this is community-engaged research that is by youth, for youth, about youth, but mentored by folks on the Scientific Advisory Board. And that's why I think their work has had such impact in a short period of time.
Scientific Advisory Board is a roster of my heroes, people whose work I have admired for so long and whose science is solid.
The AIMS Ideas Lab is a wonderful way to provide data from students surveying each other. And that information then is sent to the mental health community. So those teens get to survey, they get to research, they get to present, and they get to be part of the solution in the conversation. Then those results are actually shared with the school and the county and the mental health community.
For most students, if their friend was dealing with a mental health issue, they wouldn't know how to support them. A lot of the times people believe that mental health is a joke and they don't really take it seriously. So realizing that this is a real thing that truly does affect people around you and has an impact on your community, and educating people on how to help everyone around you is really important.
So one of the very important initiatives that AIM has been engaged with is educating the public by providing training in youth mental health first aid, and educating young people by providing training in teen mental health first aid.
AIM's Teen Mental Health First Aid is so incredible because youth are more likely to see signs and symptoms than family members. In fact, from our AIMS Ideas Lab reporting, a majority of youth said that they're more comfortable seeking support from their partners or their friends before going to family. So now, empowering the next generation with these tools is so impactful.
Biggest challenge that we had when AIM first started was everyone talked about mental health as a stigma, that it was hard to talk about. And that universe has changed over the past 10 years. Now our biggest challenge is it's such a big problem. How do we tackle it? And I think what's most remarkable about AIM is that we've created programs that look for answers from kids. We're not just going the parents down or academia down. We're really asking kids what they need on the front lines, and their voices are remarkable and they're very clear.
AIM's mission is really important to me because I feel like they are doing something that's unique by really talking about it in a way where it's inviting instead of intense and kind of intimidating. It's scary to talk about sometimes. AIM does it in a way that's very natural and allows teenagers to be a part of it.
Mental health is for everyone, and mental health challenges affect everyone. By taking what we know from the science, what's been shown to have evidence to be effective, and applying it in the everyday lives of our young people, I think that's what makes AIM for Youth Mental Health such an important organization.
So many young people who appear for treatment have mixtures of problems. They're not just depressed, they're not just anxious, and so we need treatments that span an array of different problems.
What struck me the most about AIM is that it's focused on hope. It's not focused on how big the problem is or the pain that people are suffering. It's founded in the roots of we have a hope for a better way of being, and we're all dedicated toward finding that and helping as many kids as possible.
It's a huge void in the mental health community. There is hope out there, and AIM is leading the way.